Welcome back to Living 808. Today in our In Sickness and in Health segment, we are learning more about opiates. We invited the experts from Adventist Health Castle on to answer some of the questions like, how are they effective? Are they unsafe? Can they be unsafe? Mike Jaffe is part of the Physical Medicine and Rehabilitation Department at Adventist Health Castle. He joins us now. Thank you for being here. Appreciate it. Good afternoon. Okay, so I want to know, a lot of people may not know, but what are prescription opiates and how are they dangerous?
Well, opiates are pain pills that affect areas of the brain with morphine-like effects, and they have side effects of sedation, respiratory depression, constipation, and euphoria.
Okay.
These opiates can be very effective for pain management. However, they have some bad effects where they can lead to addiction and even death. In fact, 2016, the CDC released results showing that 42,000 people died of opiate use, overuse, and incorrect use. And in 2017, it's going to be more like 50,000, making opiate-related death the #1 cause of death for people under the age of 50.
How did opiates become such an abusive and addictive epidemic here in the United States?
Well, you know, it's a very interesting question. In the mid-1990s, the Joint Commission on Accreditation for Healthcare Agencies started this national campaign determining that pain should be a fifth vital sign up there with blood pressure and pulse.
Okay.
However, there was no education for physicians, there were not good studies, and there weren't good guidelines on how to prescribe opiates, which led to a leniency in prescription writing practices.
I want to know about Hawaii. Tell me about just addiction here in Hawaii. Do you have any statistics on that, or?
Well, it's, as we know, a national epidemic, opiate overuse, addiction, substance use disorder. Hawaii is maybe slightly a little bit less than some of the states located on the eastern board of the U.S., but it is a problem everywhere. And like I said, it's the #1 cause of death for people under the age of 50, so we're very vigilant about trying to dial down opiate prescribing practices here in every state.
Yeah, how are you guys doing that? Because it is an epidemic. How are you guys trying to curb abuse?
Well, the CDC has set up some guidelines to help physicians with writing practices, and some of the things we're doing is we're creating ceiling doses of opiates, not writing for more than 100 milligrams of opiates in a day, and that seems like a lot. And we're, in our physicians' offices, we're doing urine drug screens, we're having patient-controlled substance contracts, and Hawaii has set up a statewide database, so every time we write a prescription for opiates, we check this database to make sure the patients are taking the medications that we prescribe them and then aren't doctor shopping around.
I think everybody who watches this show on a regular basis knows that I live with a certain amount of pain daily, almost every moment that I'm awake. But I don't take pain pills. I don't like pain pills, but I know you know of a lot of alternatives. There are alternatives for folks like me.
Yes, absolutely. And as physicians, we need to do a better job of prescribing non-opiate treatment options for patients with chronic pain, such as acupuncture, physical therapy, cognitive behavioral therapy, and non-opiate medications. Western medicine has limitations, and even though we can influence pain, we can't always get rid of it. And a lot of the studies are showing that now the risks of using opiates are really greater than the benefits for non-cancer chronic pain conditions like headache and low back pain.
How are some of these things being dealt with? I know that folks that, because you don't want to get anybody addicted to it, but pain management, how do you help people along with that? How do you discover it?
Well, I'll be giving a free lecture on August 9th with Adventist Health Castle Hospital. Please feel free to call and set up register to come listen to me talk. And we'll be talking about opiates, the names of opiates, the strengths, when they work, when they don't work. And we'll be launching into a big discussion on non-opiate therapies to help patients with chronic pain. But to answer your question specifically, Western medicine has its limitations, and we can't cure all pain, even though we can influence it. And so what we're doing is helping patients focus on function and how to work around their pain so they can have happier lives and feel the pain less.
How can somebody get more information on your August 9th lecture?
You can call Adventist Health Castle Hospital, and they can register. Again, it's a free talk on August 9th, and we'll be answering all kinds of questions.
And we'll have that link for everyone else on our website, too. Thank you so much for being here. I appreciate it, and this is a big topic, and I know a lot of people want to know about it, so thank you for being here with that.
It's really been my pleasure. Thank you so much.
All right. Coming up, all you need to know about the Haleiwa Arts Festival.